is, again, AARP, Arizona Hispanic Connection. We are coming to you live from Phoenix, Arizona. Our guest today is Andrea Parra. She is with the Area Agencies on Aging. She is a volunteer supervisor and a Medicare counselor. Andrea, thank you so very much for making time and welcome to our show.
Thank you for having me again.
All right. Okay. It seems like we have Facebook running fairly well. If the audio is not good, I would ask somebody out there to let us know. Let us know if the audio is it's okay. All right. So, Andrea, let's review a little bit. The navigating health plans is not an easy thing for anybody. And even though we are focusing on Medicare, as we said last time, Medicare really touches other programs, other health insurance coverage. So let's do a little bit of a review, if you don't mind, and it's perfectly okay if we repeat some of the things that we said last time. So first of all, we said last time that when people reach 65, which is the age when people sign up for Medicare, we don't like to use the word have to sign up, but in essence, you have to, because if you don't, even though it's voluntary, we have to be fair and say that it is voluntary, but if you don't sign up when you are supposed to, you are penalized. And we can talk a little bit more about that later on, but let's just review. We have at least 4 minutes in this segment to do that. Last time, we said that people come from different scenarios, right?
Correct.
So how about those that come, say, from group insurance? What happens, again, with those that are working and they have insurance and they reach 65? In brief, what can they at least consider?
So the majority of individuals that are covered by an employer group health plan don't need to sign up for Medicare, the majority of them, especially if they plan on continuing to work. They do not want to retire at 65 and want to continue working. They don't have to sign up for Medicare because the insurance that their employer is offering is considered creditable. If it's not considered creditable, then they must sign up to avoid these late enrollment penalties that you mentioned.
So, excuse me, people who are working, if they're going to continue to work, they're okay not to sign up. Do you recommend them to basically ask maybe the insurance company of HR if the insurance they have is counted as creditable?
Correct. Definitely speak with HR to determine that. And we also encourage them to speak with us, the state health insurance assistance program, because maybe Medicare and what Medicare offers might be a better option. For example, if your employer group health coverage has a high premium or a high deductible or doesn't cover as well as you think it should, and maybe Medicare does, or it's more affordable, then at that point we would advise drop your insurance through your employer, your health insurance through your employer, and sign up for Medicare A, B, D, and whatever else you need, and we could help with that process.
Let's go to those that they're considered retirees. They retire basically, but somehow they kept insurance from their former employees. What happens with them, real quick?
So again, those individuals, to avoid all of this, goes back to the late enrollment penalty. To avoid the late enrollment penalty, they should sign up for Medicare A, B, and C or D. Otherwise, they will be penalized if they don't sign up at 65. There is an exception, and it's those people that have worked for the federal government and are covered by federal employee health benefits.
Good. Now, how about those that have a marketplace, the so-called Obamacare? They have a plan, they reach 65. What are they supposed to do?
Same concept. There is an exception in the sense that they could keep both their marketplace plan and Medicare for at least or till the end of the year. They should speak with, again, a SHIP counselor so we could go into detail, but the majority of individuals in a marketplace plan must drop their marketplace plan once they turn 65 and sign up for Medicare.
VA, people who serve in the military, they have VA services. What do they do?
Again, same thing. To avoid the penalty, they should sign up for Medicare. I do counsel a lot of veterans that decide not to sign up for Medicare, and the VA covers them perfectly well. But I make them aware that if they need coverage outside of the VA for any reason, they at that point they would be considered signing up late, and they would be penalized for signing up later on.
So the bottom line here is that people have the freedom not to sign up for Medicare if they don't want to, but if they do not do it when they're supposed to, there will be a penalty, and
Correct.
that is the bottom line.
Bottom line.
That's why it is so critical that when people reach 65, they really know what they need to do depending on whether they come from group insurance, retirees, the health, the marketplace, and VA. We are going to have to go on our first break. Stay with us. You are listening to AARP Arizona Hispanic Connection. We will be right back.
Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection, a radio and social media platform designed to educate, to celebrate Latino accomplishments, and to connect communities. This is our objectives. And today we are addressing health insurance, navigating your plan number 2. Last week, we addressed number 1, and this show you can find the video of the show on our page, again, Facebook, AARP Arizona Hispanic Connection. Real quick, Andrea, I know we have a lot to cover for this show, but just real quick, people who don't have insurance, of course, they have to sign up for Medicare. Correct. To avoid the penalty.
And also to have insurance.
Right. And we have to say that the bottom line here, again, is penalties, penalties, penalties. There is a penalty for Part B, and there is a penalty for Part D if you enroll late. If you do not enroll when you are supposed to, of course, you have freedom to not enroll ever if you don't want to on Part B or Part D. You have the choice, but if you ever repent and come back, Medicare will, of course, sell you Part B and D, but there will be a penalty for all those months that you were without insurance.
And I want to emphasize that the penalty, it's not just a one-time financial amount that you pay. It's per month that you have the coverage.
The percentage, whatever that is, that will be added to the monthly premium, correct?
Correct.
For life.
For life.
And there is only one exception to, well, the penalty is not forgiven at all, but if somebody has a special programs that we're going to talk about later on, then those programs pay for that penalty. But let us not get ahead of ourselves.
Correct.
So we can, all right. So now, folks with less than 40 credits, we said that if somebody doesn't have 40 credits, they will not get Part A premium free. They're going to have to pay for it. So it is available at a cost. So it is important to have those 40 credits to get Part A premium free. Then the spouses with less than 40 credits or no credits at all, if the spouse of this person does have the credits, then based on those credits, the spouse without the credits can get Medicare.
Correct.
And also, of course, Social Security, even though that's not the subject today. And, of course, people who have access, or let me clarify, a health plan from Access before Medicare is not the same as a health plan Access after Medicare. Am I correct on that?
You are correct.
Yes, so if you have an Access plan before Medicare, when you sign up for Medicare, that plan will have to change. It doesn't necessarily mean that the company will change. It may be that you'll get a different plan with the same company, but it will definitely be a different plan. And we'll get to those matters in just a bit. This brief conversation basically tells you that Medicare is, I don't know, for you, Andrea, you've dealt with it for how many years you've been with the agency? 5 years with the area agencies and agent. I've been with AARP for 15 years and basically learning about these things. To us, it's kind of simple, you could say, but I can imagine people who've never handled terminology of health insurance, how difficult these things must be. But the good thing is that you can reach the area agencies on aging. They're all over the state. And just give it the number, Andrea, if you don't mind, the number where they can reach the area agencies on aging, that so they can get help with Medicare.
Yes, so we are housed at the Area Agency on Aging, but we are also the State Health Insurance Assistance Program. We are funded by CMS, the Centers for Medicare and Medicaid, to provide free, unbiased, and personalized Medicare counseling. You could reach us at 1-800-432-4040. Again, that's 1-800-432-4040.
Good. Let's move on now to another area, and that is it possible to have both Medicare and Medicaid, which in Arizona is ACCESS, and ACCESS stands for Arizona Healthcare Cost Containment System. I want to repeat that. ACCESS stands for Arizona Healthcare Cost Containment System, and ACCESS basically is Medicaid in Arizona, and they have acute health plans. They also have some other programs that we're going to talk about next. So the question again is it possible to have both Medicare and Medicaid? And if so, through what means can they have both?
So the answer to your first question, yes. If someone is eligible for Medicare and also meets the eligibility criteria for Medicaid, which I will address as access, yes, you will be eligible for both health insurances. Again, Medicare and access. And those individuals, we refer them as full dual beneficiaries because, again, they're eligible for both the Medicare health insurance and the access health insurance.
Do they refer to also as Medi-Medi? Or I heard it.
Maybe I believe California has some plans that they call Medi-Medi plans.
Medicaid,
yes,
and Medi-Cal in California. Okay.
Yeah.
Now, so I guess one of the highlights that I consider for this program, Andrea, and I hope you agree with me, is that there is financial help, because see, when people reach retirement age, many, and I mean many people, do not have enough resources, or let me just put it in a different terms. They are either below what the federal poverty level, or just slightly over the federal poverty level. And this is an amount that the federal government establishes to measure who lives in poverty, literally. And it's called a federal poverty level. So that level will be used to determine who gets some help, correct?
Correct. And that help basically comes from access.
Okay.
So all access programs, and there's several, I believe it's over 10 of them, are based on the FPL, the federal poverty level. So they have these monthly income guidelines. So they assess your income versus that guideline to determine eligibility, and that will determine the program that you qualify for and the benefits that you will receive from that program.
Okay, so here again, I've said it many times that if there's ever a time when having low income it's helpful, this would be one.
Correct.
Because people who have low income are taken care of by the federal government through Medicare and by the state through Medicaid. So let's go into the nitty gritty, Andrea, of this programs. I'm having to basically maneuver between you and my Facebook page here. Did you already mention the savings programs or not?
Not yet.
Okay, let's go into that. So to be more specific, the ways by which a person can get help to pay for Medicare costs and coverage is through these programs called Medicare Savings Programs. You call them internally SMPs?
MSPs.
Oh.
It's
see?
just the acronym.
Right, MSPs. Sorry, I got it wrong. MSPs. So anybody out there is help for those who have low income. So let's just touch upon, Andrea, if you don't mind, the income levels, just the income levels, so that people get an idea what are we talking about when we're talking about income levels. Go ahead.
Okay, so for the Medicare Savings Programs, there's 3 categories. The qualified Medicare beneficiary is one. The SLMB programs, specified low-income Medicare beneficiary, is the second. And then the final one is the QI1 program, which is the qualified individual one. Bottom line, these programs help Medicare beneficiaries save money. It
Right.
offsets the cost. So for the qualified Medicare beneficiary, your income, if you're a single individual, gross income, so before any type of deductions, cannot exceed $1,061 per month. If you are married and living together, your combined gross income cannot exceed $1,431 in order to qualify. So if your income is at or under those amounts, you will qualify for the QMB program, the
Right.
Qualified Medicare Beneficiary
And that
Program.
is the program with the top help, right?
Correct.
They're going to get the most help. Now, internally, you refer to that as a QIMBY, right?
QIMBY.
SLIMBY, and QI1.
QI1,
Let's just say those just to make it a little easier for the audience. QIMBY, SLIMBY, and QI1. Now, remember, each of these names, kind of funny names, QIMBY, SLIMBY, and QI1, they have a threshold, an amount that if people make that amount or less, they become eligible for that program. And we're going to talk about what exactly is that benefit, but let's just make sure. So you cover the income thresholds for QIMBY, right?
Yes.
Can you cover the ones for SLIMBY?
Yes, for SLIMBY, for a single individual, your income cannot exceed more than $1,261, and for a married couple, $1,711. And again, this is gross monthly income.
Perfect. How about the last one?
The last one is a little bit higher. If you're single, your income cannot exceed $1,426, and if you're married, it cannot exceed $1,923.
Okay, so here, let's repeat this again. There are individuals when they reach Medicare whose income is pretty low, and there is hope and there is help for those folks. And the idea here is that they have to meet an income criteria. Now, let me ask you, Andrea, I know that for some government programs, they consider resources. Are these, do these programs have resources guidelines? And if so, are they taken into consideration or not?
No, and that's the beauty of these programs that at least here in Arizona. So every state manages their Medicaid program and establishes criteria. In Arizona, under Access, we do not count your resources, your assets. So you could have $5,000 saved in the bank. they won't look at that. They will strictly look at your monthly gross income.
So you are saying that some states might look into the resources, but not in Arizona.
Correct.
I believe in California they don't either. But let's just not go to California. Let's stay in Arizona. So you're saying that in Arizona there is no asset or resources guideline or limit that they have to meet. They can have whatever money, but what they're going to count is the actual income.
Correct.
Now, are there instances where folks may be eligible for certain benefits that when they go apply for this SLIMBY, QUIMBYs, QI1s, they may be asked to apply for those benefits first? Is there such a thing?
Yes, there's different. So not for the criteria to be eligible for these programs, they don't just look at your income. There's other things that they look at as well. But for the income portion, they do want you to apply for all potential benefits available to you. So if a veteran applies for one of these 3 Medicare Savings Programs, they want them to apply for VA benefits. And if they get denied because they don't qualify, as long as they have that denial letter, they could provide that to Access and move forward with the application.
Since it's based on money, how about Social Security? If they're already eligible for a Social Security benefit, will they be asked to first apply?
At a certain age, yes. So it's mostly at their full retirement age that they will ask them to apply
Not
for.
before?
Correct. Not for that. It depends. They could speak with us and we could explain that, but generally speaking, they want you to apply for all potential benefits available to you.
As a general rule.
Correct.
Thank you. We have to go on our next break. Stay with us. You are listening to AARP, Arizona Hispanic Connection. We'll be right back.
Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. The subject today, health insurance, navigating your plan number 2. With us today, our special guest is Andrea Parra. She is with the Area Agencies on Aging Region 1. They cover Maricopa County. And just for your information, the Area Agencies on Aging are all over the state. We have 8 regions. So if you are listening to us via Facebook from another area that is not Maricopa County, you can Google it. I suppose you can Google the Area Agencies on Aging, and then you'll find the region that belongs to you, and that is very important. They are, I'm telling you, they are the place to go to when it comes to Medicare. We obviously we want people to understand and know that there are insurance agents, insurance brokers that also help people with Medicare questions and help them enroll. That is very valid. They do not charge. They are supposed to tell you the facts and about all the programs. The only difference is that they are for-profit, and the Area Agencies on Aging are not for-profit. That is the biggest difference. And then that there you have it. Andrea, let's continue to talk about this crucial to me, because I meet a lot of people and I get a lot of phone calls of people that are, and obviously you with the agency, you get a ton of calls with people that have low income, and they struggle. I mean, today, just before I came to the studio, I had a call that somebody who needed to sign up for Medicare. They went, and when they learned that they had to sign up for Medicare Part B, that he didn't want to do it. He did not want to do it because he has to pay.
Correct.
And he didn't realize he needed to pay. And so that tells me that he was afraid that he was not going to make ends meet. So now he's still working, and that's another story. But the bottom line is that many people come to Medicare with very limited income, and this Medicare Savings Programs are so critical. So we already covered the 3 programs with the income guidelines. Go ahead.
Yes, and I do want to mention that the Slim B and QI1 programs, they pay the Medicare Part B premium.
Okay, so yeah, that's exactly where I was
Okay.
heading to. Let's go one by one.
Okay.
Okay, so since these benefits have different guidelines, and we already said that the Quimby is the one that offers the most
The
help.
richest in benefits.
I suppose let us knock down, if you will, the last 2, because I understand that the Slimby and the QI1, they have the exact same benefit. Am I correct on that?
Correct.
And if so, what is that benefit that Slimbys and Quimbys get?
So Slim Bs and QI1.
Sorry,
So
yes.
the individuals that are eligible for either the Slim B or the QI1 program, those individuals are not eligible for an Access Health Plan. So that's very important to understand. I get a lot of clients that call in saying, oh, I have access, I have an Access Health Plan, I have an Access Health Plan, when in reality, they don't. They're eligible for the SLMB program, Slim B, or QI1. And the benefit to that program is that the state of Arizona pays their Medicare Part B premium. So that individual that you mentioned earlier that called you, if his income was under the guidelines, he would have the state pay the $135.50 Part B premium paid for.
Right.
So that would be him saving that money. Hence why we call these programs the Medicare Savings Programs,
Right.
because at the end of the day, they do save money to the beneficiary.
So it is critical. You know, one of the things that happens when people go to the Social Security Administrations to sign up for Medicare is that they get a card that is for Part A and Part B, and they think they are covered. Some of the workers from the Social Security Administrations recommend or refer them to your agency, but not all of them. And I want to say this as many times as I can. When you leave the Social Security Administration, your enrollment on Medicare is not complete.
Or if you get your Medicare card in the mail, it's
Right.
not complete. If you get your red, white, and blue Medicare card, just remember that you're not done, that you need to do something else to complete your enrollment. Because if you don't, you're going to be penalized and you won't have the coverage that you might need.
This is critical. Again, we have to repeat this many times. If you have your Medicare card with parts A and B, don't think that the enrollment is complete. You still have to make some other decisions, which, and not only that, but it doesn't have prescription drug coverage. So at the
Exactly.
very least, it does not have a Part D component to it, which is medications, prescribed. So please know that if anybody enrolls in Medicare, or when you do enroll in Medicare, you will get parts A and B from Social Security Administration, but that enrollment is not complete. You're going to need to talk to the area agencies and agent, or if you so desire, with an agent or broker.
And we will help you through the whole process. We'll explain your options. We'll even enroll you into your drug plan or Advantage plan. And we will assess if you're eligible for any of these 3 Medicare savings programs to help the beneficiary save money.
Right. Okay. So again, 3 Medicare savings programs, not plans, programs. And we already said that the last 2, even though they have different income guidelines, they do the same exact thing, which is to help you pay for Part B premium, which basically is about $134 in 2019, correct?
In 2019, it's $135.50.
Okay, to be more exact.
Yes.
So that means the person would be saving $135 every single month that the state will pay Medicare for Part B.
Correct.
That is a great help. However, we said that these are the ones that get the least amount of help. So how about the first one, the top, the Quimby? Anybody who is eligible for a Quimby, what are the choices for them?
So the benefit is, if you are eligible for the QMB program, is that not only will the state pay your Part B premium, just like Slim B and QI1, but they will also cover your Part A deductible, your Part B deductible, and the most important thing, your Part B coinsurance. Part B, it's an 80-20 plan. It covers 80% only. So you as a beneficiary are responsible for the 20%. But if you're eligible for QMB, the state will cover that 20%.
Wow.
So again, Medicare will cover roughly 80%, and your access plan under the Quimby program will pick up the other 20%. So that person would be 100% covered.
So, I mean, I understand that people with dual eligibles with both Medicare and Medicaid, which is access in Arizona, they end up paying dollars. Am I correct? Primarily for prescription drugs, you're talking
Correct.
about $2, $3, $4 or so?
Yes. So all of their inpatient hospitalizations and any outpatient service, assuming they follow the rules of Medicare and Access, meaning you have to go to a Medicare doctor and an Access doctor and things like that, you have 100% coverage. Your prescriptions, you won't have 100% coverage, but almost. You will pay $1.20 maximum for generics and $3.80 max for brand name medications. But everything else, so hospice, hospitalization, your laboratory, your specialist visits, your wheelchair if you need a wheelchair, everything will be covered 100% because you would have Medicare picking up the 80% as your primary insurance and your access plan as your secondary picking up the other 20%.
Medicare becomes primary, and that's why Medicare is very, very strict in having those that are on an access plan to enroll on Medicare.
Correct.
Well, not necessarily Medicare. The
Access.
Access is very, very interested in having people sign up for Medicare because, again, Medicare is primary, Medicaid is secondary.
Yes, and Access, and they have it all over. They always say Access is the payer of last resort. So that's why, and we covered this a little, they want you to apply for every potential benefit out there, not only financial benefit, but health insurance benefit.
Right.
So if you want to not sign up for Medicare because you want to keep your Access, let's just say, that's not a good idea. You have to sign up for Medicare because then Access won't cover your benefits.
They literally would cancel the plan, I would imagine.
Yes.
Because you have to sign up for Medicare at 65. Now, let's use 2 or 3 minutes, Andrea, to talk about the following. So, those of us who know about Medicare at least a little bit, we understand that Medicare comes in original Medicare and Medicare Advantage, which is Part C. I say it slowly because that's kind of confusing. So are you saying that a Quimby beneficiary can go either direction? They can go to original Medicare, and by that it means that Access will pay literally for the coinsurance and the
Correct.
deductibles and everything, or they can go with the Medicare Advantage plan, correct? And is that Advantage plan a special kind of plan?
It can be. So there is original Medicare and a Medicare Advantage plan option for those on Medicare. The way I describe it is, think about Access as your secondary insurance, and you could have any flavor of Medicare. You could have original Medicare as your primary and then your Access plan as your secondary. You could have a Medicare Advantage plan as your primary insurance and then your Access health plan as a secondary insurance. There's different types of Medicare Advantage plans. There's regular HMOs, there's PPOs, there's chronic condition Medicare Advantage plans for people with certain chronic conditions like diabetes and heart conditions. There's institutionalized Medicare Advantage plans for people who live in a nursing home. And there's other special needs plans called full dual Medicare Advantage plans. And those full dual Medicare Advantage plans were created precisely for people who are eligible for both Medicare and Medicaid. So again, these
and what
beneficiaries.
is the main characteristic of that particular plan?
The main benefit of the full dual Medicare Advantage plans is that it offers the most benefits towards vision, dental, and hearing. Original Medicare does not cover dental, vision, hearing at all. Some regular Medicare Advantage plans might, and if they do, it usually comes at a cost to the beneficiary.
Right.
Whereas the Medicare Advantage plans, they're the richest. They could cover up to certain plans, because there's 7 to 8 plans, up to $3,000 for dental work, maybe $250 to $350 for glasses, and they even cover hearing aids.
Right.
So that's the main benefit why we would advise a full dual Medicare beneficiary, in other words, eligible for both Medicare and an Access Health Plan, to enroll into these plans, because they will get the most benefits towards dental, vision, and hearing.
Thank you. It's kind of, obviously, it's complex. I mean, we will not shy away from admitting it. It's kind of complex, but the good thing is that you only have to know the basics, and the area agencies on aging will do the rest for you. So again, when you go to the Social Security Administration, you enroll, please remember the enrollment is not complete, and go to the area agencies on aging, or again, if you have an agent or a broker, that's very valid, that they can help you as well. Let us go to our last break now, and I just want to say that if you are listening by radio, please, 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 when you have a chance, later this evening or whatever, whenever you have a chance, look for our page, AARP Arizona Hispanic Connection on Facebook, and follow our page. This is extremely important, because come next year, we are going to measure whether we want to continue to do these shows, depending on whether we hear from you. If you let us know that this information is helpful to you, it is very important, therefore, that you follow our page and let us know. Stay with us. We'll be right back. This is AARP Arizona Hispanic Connection.
Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection. I feel so happy. I almost say this, I say this almost in every show, because I am. I think there's nothing more gratifying than sharing information, and information that makes a difference in people's lives. I said earlier that I received actually a couple of calls before I came to the studio, and it's, people need the help, and I am glad that we're providing some of that. Andrea, last segment, again, Andrea Parra with the Area Agencies on Aging is our special guest today. Let's talk about changing plans, because I don't have as many options with my group insurance at AARP as I see that people on Medicare have. Briefly, what sort of things can they do in terms of changing plans?
So the individuals that are both the full dual, so the ones eligible for both Medicare and Access, they have the most options. They could actually change their plan every 3 months, every quarter.
Wow.
Yes, that's actually new. Before that, they could change it every month if they wanted to.
Okay, what kind of plan is that again?
for their Medicare plan.
Okay.
So if you're eligible for both Medicare and Medicaid, you could change your Medicare plan. Last year and prior years was every month. This year, moving forward, it's every quarter.
Wow.
Yes, but generally speaking, those on Medicare could change their plan every year during the Medicare open enrollment period.
Right.
They added a new enrollment period this year as well. It's called the Medicare Advantage open enrollment period, and we're currently in it. It starts January 1st and ends March 31st, and it's only for those on a Medicare Advantage plan.
Okay.
So if you're on original Medicare, this does not apply to you. But if you're in a Medicare Advantage plan, you could change to another Medicare Advantage plan, or even go to original
Go back to
Medicare
original.
if you want to,
Okay.
again, by the 31st.
Got it.
And besides those
Okay, so
enrollment
let
periods,
me be clear. So the October, what is it, 15 to December 7?
so the open enrollment
that's
period,
open enrollment. That's for Medicare Advantage and Original, whatever you are able to do.
Correct.
That. Then that finishes. But then for those on Medicare Advantage, they have an additional period
Correct.
of 3 months, literally,
more
that
months.
they can make changes.
that's correct.
Got it.
And then there's a special enrollment periods that applies to everyone. It doesn't matter if you're on original Medicare or Medicare Advantage plan. For example, moving from one county to another or one state to another gives you a special enrollment period. That's probably the most common. If you lose your group health insurance coverage through your employer, that allows you to sign up. If you lose insurance through no fault of your own, maybe the company that you're with went bankrupt or whatever, there's tons of special enrollment periods that will give you the opportunity.
Open enrollment is
to
special,
change.
and then that extra period for Advantage.
The open enrollment period and the Medicare Advantage open enrollment period are static. They're
Right.
every year.
Same dates.
Correct.
But then
Whereas
the special,
a special
it
enrollment
depends on
period.
when the circumstance
Correct.
happens.
It's like a life-changing event,
Got
they
it.
call it.
All right. Because of time, Andrea, let's go to another point. We have 2 more to cover. You know, there is an issue with prescription drugs. Sometimes, I mean, we witnessed a case where somebody was taking a brand name drug that was working well for them. When they changed plans, they prescribed them a generic. And then there was an issue. What happens when somebody, a drug is not working for the person? Can they somehow do something to get the prescription drug that was working for them?
Yes. So this goes hand in hand with the subject of this show, navigating your health plan. You need to understand not only what benefits you have, but how you could access those benefits. And your medications, there's different ways that the plans manage your prescription drug benefits. So, for example, there's prior authorizations, there's quantity limits, there's step therapy, there's tiers exceptions. These are all ways that plans manage your benefits. So if you don't follow a certain step, you will not get the coverage for the medication, for example. So with that example that you mentioned, that's called step therapy. When that person changed plans, that plan requires you to try other medications first before they could approve the brand name medication, because at the end of the day, the brand name medication costs more to the plan and eventually to you. So if another medication that is generic and less expensive works for you, the plan will want you to try that one first. And if it works, great. If it doesn't, then they will approve the brand name medication.
What triggers that? I mean, what is the process for you to request that as a beneficiary? Do
Usually,
you begin the process?
You can, but always go through your primary care physician. They will send the prior authorization to your plan. They usually do that for you. And they will notify you. The plan will also notify you saying, hey, your prior authorization for XYZ medication is approved. Now you can start taking it and so forth. So you need to understand that there's benefits. You need to understand what they are and how to access those benefits and follow the guidelines, follow the steps of the plan.
So I take it that anytime someone is forced or voluntarily changes plan, they have to be very aware of changing doctors, possible certain medication not being covered, the generics, the brand. Am I right on that?
Correct. So it's not just making sure that the plan covers your medication, but does the plan require step therapy first? Do you have quantity limits for that plan? That's another big issue where my plan covers only 30 pills per month, and the plan that I switch to next year maybe covers more, 60. So we get a lot of issues like that where clients are complaining, saying, my plan doesn't cover it. And we have to explain and educate and say, it's not that it's not covering. It's just that there's a quantity limit. So then next open enrollment period, when they have the opportunity to change, that's something that they need to keep in mind. Oh, I need a plan that covers 60 pills per month versus 30 because that's how many I need, and so forth.
So I gather that Medicare set rules, but there's flexibilities for the plans in those regards.
Correct. Every plan can have any of these restrictions in place, and it's up to the beneficiary to be aware of those before changing into that plan or not changing.
Okay, the last point, we only have a couple minutes, maybe 3 minutes. When people go to access care, they go visit the doctor, they go to the hospital, what have you, I have to believe that triggers some kind of notice that is sent to the individual. I believe in every case.
Correct.
They're going to receive a notice. Are they invoices? Are they bills necessarily?
No, if you get it, anything from your plan, most of the time it's just a summary. For original Medicare members, it's called the Medicare Summary Notice. They get it every 3 months. For Medicare Advantage Plan members, they get it what they call an EOB, explanation of benefits. So it's just a summary of the benefits that you received, how much the provider charged your insurance, how much your insurance approved the amount, how much they covered, and then how much, if any, your copay or your responsibility is. So don't be alarmed if you received an MSN, a Medicare Summary Notice, or an EOB, an explanation of benefits. It's just telling you how much your insurance covered. Imagine if you didn't have coverage, that you would have to pay it all entirely, but it's just a summary. Now, if you get a bill from an actual provider or some kind of notification from an actual provider, a doctor's office, a hospital, then that's most likely a bill.
So the bill, anything that you owe the insurance company, they'll charge it to you in the form of a copay or so.
So remember, you owe the benefit not necessarily to the insurance. I'm sorry, you owe not to the insurance, but to the provider for that service.
Okay, and that's what triggers a second bill correspondence that you might get on the mail.
And the MSNs and the EOBs, it says right there, this is not a bill.
Okay.
This is not a bill. So you should get worried if when you read the MSN or the EOB, that summary, that the insurance did not cover and it says denied. Then that's when you need to call us or call the insurance and ask them, why didn't you cover this service? What was the issue?
And that's another question. Are there scenarios where Medicare or the Advantage plan didn't cover for whatever reason some treatment, some test,
yes.
and they can call you, and then you reach out to this insurance, and then they actually eventually cover it?
Yes, and that happens all the time. I mean, Medicare is not perfect. They make mistakes. They don't cover things when they should have, when it's medically necessary. You could reach us. We could explain everything. We could reach out to Medicare. We could reach out to your insurance company. We could reach out to the provider and say, hey, what happened here? And we also help with the appeals. So if it turns out that you need to appeal, we will help with that process as well.
I just don't, I don't know. I mean, I assume that the open enrollment period for you at your agency is a lot of work, a lot of stress. What is the life like in those days?
It's very, crazy. Very busy. Yeah, it's the time, the busiest time of the year for us. But like we're saying here, we don't just help with enrollment. We help with appeals. We help with educating you. We help with navigating. At the end of the day, we help you navigate your Medicare plan.
I use the proper term then, right? Navigating
we
your
help
plan.
you navigate Medicare. It's complex. There's a lot of options. It's complicated. We make it simple for you to understand your benefits, how to acquire your benefits, and save money at the end of the day with the Medicare Savings Programs, the Extra Help programs.
You know, it's unbelievable. It's complex. I mean, no doubt about it. And I am so glad that we have this program. And more than that, that there is help with the area agencies on aging. You know, I have never spoken honestly with an agent or a broker. I just know that I have, but not in detail. that they also help people. But I just feel that what you do, because obviously you run the SHIP program
Correct.
for the Department of Economic Security in Arizona. Obviously, this is part of the CMS, and CMS is part of the HHS, the Health, help me here, Health and Human Services and Centers for Medicare and Medicaid Services, and then it reaches Arizona as the Department of Economic Security. We only have 10, 15 seconds. You want to add anything, or are we okay?
Yeah, so if you know anyone that has Medicare, your parents, your grandparents, reach out to us. Again, not just during the open enrollment period. We're available all year long. We are there to help you and your caregivers, if you're on Medicare, navigate Medicare.
Thank you so much. This is the end of our show. Thank you so very much. This was AARP, Arizona Hispanic Connection. The subject today, health insurance, navigating your health or your plan. Number 2, remember to follow our page, AARP, Arizona Hispanic Connection. See you soon. Have a great day.
¿Vives en Arizona? ¿Sabes dónde encontrar todo tipo de información para ti y tu familia en línea? ¿Quieres consejos de salud, dinero?